You're listening to Fast Facts Perio Edition. And now, here's your host, Katrina Sanders.
Hello, and welcome to Fast Facts Perio Edition. This week, we're talking about what's genetics got to do with it. You're welcome. I know that's what all of you were wanting on this wonderful morning is for me to sing to you, but we are going to be talking about genetics and more specifically distilling down what research is starting to unpack for us when we start talking about the presence of periodontitis in parents and ultimately how that shows up in their offspring. Now, there have been some studies that have started to distill this, and I'll be the first to say, we've all seen the Minnesota Twins studies, which indicates that if there is a member of the family or some sort of a genetic predisposition, that there is a strong likeliness that the individual offspring will also likely experience this issue. So we've seen this with, families who are elevated risk for cardiovascular disease or stroke or diabetes, right? If it runs in the family, if mom or dad have it, you have a likeliness that you could be genetically predispositioned to needing to maybe manage or mitigate other risk factors. So this research study actually comes to us from the Journal of Clinical Periodontology, my favorite reading journal on a good old Friday night. And this is from April of 2023. This research study looks at parents who have periodontitis, and they wanted to understand inside of this, when do the offspring of parents with periodontitis begin to start experiencing those risk factors associated with periodontitis? Because our lizard brains in dentistry are thinking about things like, well, if there's a genetic predisposition, could it also be environmental? Are these individuals that maybe because they come from the same family, similar socioeconomic status, similar educational status, etc., that maybe there is an environmental component to this, perhaps diet becomes a contributory factor, etc. Well, inside of this study, what they specifically looked at is what they call the early acquisition of dysbiotic microbiomes. Wow, that's a mouthful. And it really is a mouthful because when we talk about dysbiotic microbiomes, what we're talking about is that shift from primarily health-producing microbiota into now an imbalance where at some point in their youth, these children whose parents are perio-prone, have periodontitis, these children now are beginning to demonstrate some changes in the strains of bacteria in their mouth. Okay, so this research study looked at how microbes colonize these different dentitions. They took two different groups. They took children of parents who were, perio-active cases, and they took children from parents who were health or periodontally healthy. So we call them the children of the perio group and the children of the healthy group. And they were matched based on gender, age, all that stuff. And we started to distill down or look at what actually happens with these children. They are, born into these families, they have experienced the immunoglobulins through birth, etc. What they found inside of these groups is quite interesting. They found that the microbiome composition for these groups was different. So the children of the perio group, again, these are children where mom and or dad had periodontitis. These children had an incredible diversity of their microbiota, and not in the good way where we're seeing a differentiation. What we started to see is that diversity started to see an introduction of what we call a pathogen-rich environment, meaning these kiddos started to present with a higher prevalence and a higher abundance of species associated with perio. These are going to be your Prevotella. These are going to be your Treponema denticola, Tannerella forsythia, etc. These are going to be your more common bugs affiliated with perio. So these kids in the perio group early on began to demonstrate a diversity in their microbiome when compared with the healthy group. It was noted that this intense shift in the community of bacteria in the mouth occurred when we started to shift from the primary to the mixed dentition in the perio group. Okay, I'll say that again. When we see these kids, if mom and or dad it is a perio case, that we start to see in these children that when they shift from a primary into a mixed dentition, that we start to see an intense shift in the community of the pathogens in their mouth. This is important because the conclusion, of course, then is that the parent's periodontal status is going to have a significant effect or impact on the composition of the microbiota of their offspring, and more specifically from an early age. Let's take a look at how that actually shows up inside of our clinical care. If you're working in a pediatric practice and you are treating children who are coming in with early gingival disease, which a large portion of our pediatric population has, we should first pause. Yes, this is plaque biofilm induced for the most part, but perhaps a deeper question could be to ask mom or dad if there is a family history of periodontal disease in the family. Helping mom and dad to understand by the time we start to see that mixed dentition, which happens, about age 6 for a lot of our kiddos. By the time this mixed dentition occurs, by age 6, we are seeing an extremely dramatic shift in the composition of bacteria in the oral cavity for these kiddos. If we know that, if we can understand that, this can drive a lot more in the way of clinical decision-making, possibly encouraging a shorter recare, possibly instituting studying salivary diagnostics, even, yes, at the young age of 6, to better understand how we could stave off potential periodontal implications down the road, and, of course, oral and subsequent systemic disease. I don't know about you, but when we start to unpack research like this for me starts to change the conversation into creating a more centric, patient-driven, individualized care plan that meets the needs of how our patients are showing up. This has been another episode of Fast Facts Perio Edition with Katrina Sanders. Please feel free to reach me on Instagram at The Dental Wine Genist or on my website, www.katrinasanders.com. Cheers.